Today for Primetime Local News, I'm joined with Avar Mendez, the Provincial Head of Surgery with the Saskatchewan Health Authority and University of Saskatchewan, to talk about a new surgical robot system that is being implemented at the St. Paul's Hospital in Saskatoon. So thank you so much for joining us here today.
Sure.
So first off, what can you tell us about this new surgical robot system that is coming to St. Paul's Hospital?
Yes, well, this is a sophisticated surgical instrument. It is what's called a surgical robot. However, this robot does not operate on patients autonomously. It is actually controlled by highly trained surgeons that have been specifically trained in robotic surgery. So the robot is under the controls of the surgeon during the whole surgical procedure. I think that's an important thing to understand, so people don't get the idea that the robot is going to do the surgery on its own. But what are the advantages of this system? So, traditionally surgery is done when the surgeons are on the operating room table. They make a big incision so they can see the inside of the body. This system allows us to do what we call minimally invasive surgery. So we don't need an incision to enter the abdomen. We just need a small puncture wound that allows the entry of these very thin robotic arms that go into the patient's body. And so the surgeon has a 3D view of the inside of the abdomen in this case, and then he can control 3 surgical arms. So this robot has one more arm than the human being. And so in these surgical arms have these very tiny surgical instruments that allow the surgeon to go into these very tight spaces and perform a surgical procedure with minimal trauma to the tissues, and of course, without the need of an incision.
But do you think that this new system will help make patients stay at the hospital easier on them?
Patients are admitted to hospital after surgery to recuperate, and one of the parts where they need to recuperate is the incisions have to heal, and that takes several days. Because there's no incisions here, and because there's only puncture wounds, actually the patient can be discharged home earlier. It increases our inpatient capacity. So the more beds available, the more surgeries can be done. And I think in this way, the robot will help with this tremendous backlog that we have of surgical cases after the COVID-19 pandemic.
And what are some of the procedures that this system will help make more efficient?
So there's very specific areas where this robot is very helpful and very good. And one of them is urology. Urology, the surgeons operate in a very tight space within the pelvis. And urology is going to be the first surgical specialty that will be using the robot. For example, they'll be able to do prostatectomies using the robot. So that will be the first area. Gynecology, and especially gyne-oncology, which is a specialty that is dedicated to cancer in the gynecological system for women that have ovarian cancer and have a uterine cancer, cancer of the head and neck, thoracic surgery, and eventually colorectal surgery.
And this will be the first of its kind in all of Saskatchewan. So how important do you feel this is that we are getting this new system?
It is very important because we're just not buying one robot. We're starting what we call our robotic surgical program. And eventually, as time goes by, as we get more experience using these surgical robots, we will be able to bring more robots in more specialties. It is part of the natural progression of technology. In the future, there's going to be 3 areas that are going to really revolutionize the way we provide surgical care. One is surgical robots. The second one is virtual care, and virtual care came about in the COVID-19 where we can follow patients at home. And the third one is going to be artificial intelligence. So those 3 areas are going to really make huge changes in the way that we provide surgery. We'll be able to do more difficult cases safer. We'll do more cases overall.
And is there anything else that you would like to mention about this new system that we haven't already touched on?
You know, the philosophy of our department is to be able to offer, world-class, state-of-the-art surgery to the population of Saskatchewan. And we want that to happen. We want the average person that needs surgery to be able to get the best surgical procedure with the best technology here at home.
So thank you so much for your time.
Thank you so much, and good luck to you.